that brings us right to this, which is that regulators and payers have distinct interests when it comes to information. Of course, payers are interested in claims data, right? Pharmacy data, information on pre-authorization, but not necessarily clinical data such as tumor staging, right, and biomarker status. So what are some of the gaps in the data collection faced, not necessarily by clinicians, but by payers?
Well, you know, and if you think about what payers are, they're transactional in nature. So if you think about all the signals that begin to come into the payer, you do have claims data, and it's very valuable, but its limitations are fairly well known. It's only as good as the information that's going to be put into the system, so think coding, and you've got some separation in the system between medical claims and pharmacy chain claims, and sometimes what you authorized at pre-auth might not necessarily come in as a claims paid that mirrors what you agreed to pay for to begin with. So there's all sorts of disconnects even within our own systems.
That's where the four-letter expletives come from on the clinicians.
Understood,
side. Yeah.
understood.
You know, I might disagree with you. I think we're very much interested in clinical information and biomarker status and tumor stage, et cetera. We don't have access to it readily unless we get it from the physicians, but our goal in paying for therapies is to make sure the right patients are getting the right therapy. That's why we have processes in place, whether it be prospectively or retrospectively, to evaluate are patients getting the drug that's appropriate for their biomarker status and their stage.
Well, just to continue on though, we do have some of those processes in place because we are limited. Claims data, as you've already pointed out, doesn't necessarily give us visibility to the clinical scenario, but that doesn't mean that we can't come up with registry-like processes, and we have. We've gotten fairly clever about being able to detect performance status, changes when we're off schedule, delays in therapy, and changes in therapy and comorbidities.
But you know, the view, I must say, from a clinician is that these insurance companies are a bunch of accountants and population analysts, and they're not necessarily interested in a patient-by-patient analysis. But I'll ask this point blank, would clinical information about the patient, individualized, stage, adjuvant therapy, metastatic state, help with some of the gaps in processing reimbursement claims?
It would help everybody. Forget about paying the claim.
Yeah.
So the issue is that the data exists in silos. The clinician silo, the pharmacy benefits manager silo, our silo, heck, the employer silo, right? Issues regarding absenteeism, work productivity, all that kind of stuff. So we've got these silos. There's very little crosstalk between them. So we can look at the claims history and we can infer certain pieces of clinical information. But in fact, getting a real cradle-to-grave view of what's happening to that patient does not exist. Now, okay, does the insurance company care? Yes, but I will tell you that it's my strong belief that providers ought to really care about this. I'll give you a concrete example. Every oncologist knows that treating a 40-year-old woman with adjuvant therapy for breast cancer is different than treating a 70-year-old woman. They may have the same biomarkers, but they have a totally different clinical course. Now, if you ask a provider, they will know that, but they will not be able to quantitate that or tell you what to do about it. So if you're the doctor and you see that that 70-year-old woman has got a 3 times greater risk of being hospitalized, you ought to be thinking of ways to fix that in your practice. Let's say you got that 40-year-old woman and you got 3 therapeutically equivalent treatment options, but one of them results in absenteeism and disability 4 times more. You ought to be thinking about that, and that data does not exist today.
It doesn't exist. What about third-party data? I mean, there's all kinds of data out there. What I'm hearing is that nobody's communicating. Isn't this the internet era? Isn't this the data-driven era?
Well, you know,
silos, they don't exist.
No, I think they do exist, and some of them are those that we put up ourselves, or at least the government put up. You know, the health insurance, you know, the HIPAA regulations really are pretty rough when it comes to understanding what we can share and what we can't share. And I think Mike is right in saying we really need to share more because we will benefit all of us more by sharing.
So I'll just make you look bad potentially.
That's okay.
That's my intention. HIPAA.
Yeah.
Gets in your way. Bad idea.
Not necessarily.
Rats, he didn't fall for it.
It's one of those regulatory statutes that has good intentions, you know, it's virtuous, but the transactional part of it is not necessarily so easy because we want to cross boundaries in data exchange that have not really been codified in the past.
So we need to fix HIPAA? Is that what everybody here is thinking?
No, I think we need to fix our broken system of paying for therapy without understanding what the results are. We pay hundreds of billions of dollars for chemotherapy and cancer treatment, but once the drug's approved, we have no way of collecting, aggregating, and interpreting that data to know how it works in the real world. And there's no one incented right now to create that type of database to allow us to answer those
Since
questions.
every therapy gets paid for somewhere, right? It occurs to me that the source of all data should be the payer base. But I'm getting a sense that you guys are...
But you just told us we don't have all the clinical data, and we don't.
And you don't, which is where we're going to go with all this. Look, there are different sources of non-interventional data, right? There's the EHRs, the cancer registries, medical chart reviews, claims data. They've all got different formats, which is another issue. This is, yes, the digital age, but everybody's got their own digits.
Yes, but who do they ask permission from to share it?
Ah, okay.